So today I'm going to be informing you on a epidemic that is running rampant in America, and it is obesity. That might not seem like a prevalent issue here at Cal Poly or even in SLO in general because we are quite healthy, but it is a pressing issue in America, so much so that it's recognized as a chronic disease by the American Medical Association and other healthcare organizations. So much so that it's opening up jobs specifically tailored for the advanced care of these obese patients. Now, is this a problem that we can attribute to one factor or many? It's obviously a very complex issue and can be attributed to many factors, socially and health related. So, let's start with socioeconomic standing and its impact on obesity. A trend is seen where the lower the socioeconomic standing of a community, the higher the rates of obesity are, and it's especially prevalent in children of those communities, and that's according to an article titled "Is Poverty Associated with Obesity Among American Children?" that was published in 2014. Another number that is interesting is, regardless of the socioeconomic standing, obesity rates are seen higher in Black communities across America. In this same article, they did a study of 50 years and observed Black communities, and they were two times more likely to have their high school degree be their highest level of education versus other ethnicities that went on to further their education. And this kind of put them at a disadvantage of this cycle where they have a lower education, so they're more likely to be in these lower socioeconomic standings, and it kind of puts them into this cycle where they are put at a disadvantage, I would say. On the subject of ethnicity, also, it's interesting to see these numbers in the Mexican American populations as well. Approximately 25% of American children, regardless of their race, are obese, which is quite high. But in an article titled "Mexican American Mothers' Perceptions of Childhood Obesity," which was published in 2011, they reported numbers of 34% of school-aged Mexican-American girls and 40% of school-aged Mexican-American boys were obese. So parents play a major role in a child's health, and in the Mexican-American culture, it's kind of emphasized that the mother plays the role as the caregiver and the father as the provider, which this is totally a generalization, but it could have an influence on these outstanding numbers. The parent's impact overall is going to have major influences on the child's learned behavior and their perception on what health is, and consequently their physical health as well. So let's get down to the numbers. According to the stateofobesity.org, adult obesity exceeds 35% in America. These numbers were recorded in 2015 and 2016. You can obviously see by this chart that numbers are quite high in South. So that could be a dietary problem or a social problem. These trends are steadying, but is that necessarily a good thing? Do you want 35% of the country to be obese? Numbers have decreased in specifically Kansas. They don't know why, but numbers have increased in Washington, Colorado, Minnesota, and West Virginia. I would consider this still that we have a need for change. Now, state policies also play a major role in obesity, especially in children, because of their major influence when it comes to school lunches at elementary schools, PE standards, and the push for physical activity amongst these adolescents. Well, in conclusion, 8% of American adults don't meet activity standards. That might seem kind of low in regards to my last comment on the 35% of America being obese, but 45% of these people who aren't considered having active enough lifestyles to have a significant impact on their health. So in conclusion, regardless of your race, your gender, where you live, or your age, it's your responsibility to put yourself in a fit state and change your lifestyle no matter the dispositions or your life.